Welcome to Drama Free Healthy Living with Jess Cording. I'm your host, Jess Cording. I'm a registered dietitian, health coach, and author, and I'm here to help you streamline your wellness routine and establish a sane, more balanced relationship with food and fitness so you can reach your goals without losing your mind. On this podcast, we'll talk about nutrition, exercise, self-care, mindset, and more. I'll be bringing you interviews and expert insight on the topics that matter to your health and wellness. Hi, and welcome back to the Drama Free Healthy Living podcast. I'm your host, Jess Cording. I've got a short and sweet episode for you today, and I just wanted to share about a topic that's really near and dear to my heart. It's starting in 2023, I started talking more specifically about the role of trauma in wellness and just the different ways that having a history of trauma can impact your health and well-being. It can impact our emotional state, our physical health, how able we feel to be consistent with healthy habits and behavior changes. And it's something that I saw so much in my work as a dietitian. I've been in meetings where team members have been like, oh, well, people, they're not exercising, they're not eating healthy because they're lazy. And I'm sitting there like, actually, no, it's not that at all. There's something else going on here. And in so many cases, over the years in my work as a dietitian, health coach, Pilates instructor, I have found that very often one of the things that can contribute to someone being stuck or dealing with symptoms that are kind of mysterious to them and their doctors, trauma can play a really big part. It's not always the only part, but it can be a factor. So I wanted to share today just a few signs of trauma or some of the effects that you may experience. And just to back up a little bit, when I'm talking about trauma, what I mean is trauma being a physiological response to a distressing event or a series of events. And this psychological response and, to this event, this can have short-term effects, this can have long-term effects, these can be mental, emotional, physical, but that's what I'm talking about. So let's just start off with some physical effects of trauma. And some of these can be short-term, some of these can be long-term, but a big one, appetite changes. So you might find that you are suddenly much more hungry or much less hungry, or you might feel really caught off guard by changes in your appetite where it swings wildly from one direction to the other. And this can come with weight changes, weight gain, weight loss, difficulty maintaining a healthy weight, so weight fluctuations. So that is something to keep an eye out for. That's something I've seen a lot in my practice. In the short term, you might see breathing changes, your heart rate increasing, because as your body is, going through a stress response, it's being primed to try to outrun a predator, so to speak. Long term, you might see cardiovascular changes. So things like heart disease, high blood pressure, which can put you at increased risk for stroke, increased risk of heart attack. Also digestive issues. That's surprisingly, well, not surprisingly, that can be very common. So, so if you find that, you start to have a nervous stomach, is a term I hear a lot, or you're prone to diarrhea or bloating, you have new food sensitivities. That's a really big one. Or things where, big changes in taste, so you can't tolerate certain foods the same way. Like, these are all things that could potentially be red flags. And of course, just there's a really big, we hear all the time about the gut-brain connection now, where the enteric nervous system in our gut is in communication all day with the central nervous system, in our brain. They're sending signals back and forth all day via the vagus nerve. And it's been well established that, what is going on psychologically can impact gastrointestinal function, but vice versa too. So when someone is their diet pattern is such that it's not supportive of healthy gastrointestinal function, or there's other lifestyle things that are not helping with gut health, that can make the recovery process from trauma much more difficult, much more challenging, or they may find that symptoms like anxiety and depression don't improve over time. Other things to look for: headaches, migraines, muscle tension, pain, fatigue, impaired immune system function. That's a big one. So if you feel like you are getting every cold that goes around, you find that it takes you longer to recover from injuries and illness, these can definitely be signs, because our immune system, most of our immune system function happens in our gastrointestinal tract. And when, so when you're dealing with some gut brain issues, one of the manifestations can be difficulty with fighting off pathogens. So I'm trying to find a non-boring way to say that, but just your immune system is not functioning optimally. We'll leave it at that. Insomnia, this is a huge one, and just sleep disturbances in general. So that might look like difficulty falling asleep, difficulty staying asleep, both. I've seen that so much with my patients and clients over the years. I cannot tell you how many people struggle with sleep as a result of stress and trauma. There's a huge connection there. Things like nightmares, night terrors, anxiety dreams, all things that can be connected to trauma history. And then something else that comes up is things like rashes, other dermatological conditions. So, these are things to also be aware of. On the psychological side, you're looking at, I mentioned earlier, anxiety, depression as some some effects of trauma. Other things that might show up, so difficulty with trusting others or trusting yourself, feelings of guilt, shame, always feeling like you have to apologize for everything. We also see some more cognitive issues, such as memory and concentration impairment, difficulty focusing. Other things that can come up: low self-esteem. That is a huge one, very often tied in with those feelings of guilt or shame. Then you might also see things like strained relationships, difficulty, depending on, what kind of stress response somebody has a tendency towards. That can look like avoidant behaviors in relationships, or, having a hard time getting close to people. Or on the flip side, that could, if someone is more, that could look like, like turbulent relationships, if they are more prone to the fight response. Sometimes you might see that someone feels, I don't want to use like overly clingy, but they kind of really lock into people. And of course, something that there's a lot of in the literature about dissociation. So feelings that you are not in your body, these out of body experiences when one is triggered, in terms of, triggering a stress response related to that traumatic event or that history of trauma. And then, of course, it couldn't talk about the stuff without talking about instances of an increased risk of eating disorders, substance use disorders, so things related to alcohol, drug use. So, these are really serious things. And I find it so interesting that if somebody has a physical condition, like they break a bone, they go to the doctor, they get it taken care of. But when it comes to trauma, PTSD, I do think there's been a shift. I definitely think that more people are talking about it. There are more services available to people for treatment, especially in the mental health space. But there's still this stigma. There's still this idea that you have to figure it out yourself, or just, my favorite is that you have to get over it. That blows my mind when people tell you to just get over it. Just forget it happened. Like, what? If you're new to me, I have written very publicly about my own experiences with PTSD and trauma recovery as a result of sexual assault as a teenager, and just the stigma that I faced, the difficulties I had with feeling like I was able to talk about my experiences, but also how I used nutrition, movement, things like mindfulness, journaling, breath work, just everyday stress management tools and sleep hygiene to help navigate that journey. And over the course of my career, I've been able to help other people with that too, and that has been so meaningful, just to see somebody realize that they're not broken. They're not bad at staying on track with healthy habits, right? Like they're not lazy, but there's something else that's holding them back. And just to be able to help someone kind of unlock that door and be able to go through that passageway and just get to where they want to go. That is just that's why I do what I do. It's so wonderful to see that. And after I published an article in Mind Body Green in January of 2023 about my experience with PTSD healing, I got so many DMs from people who were like, "Oh my gosh, I'm going through this too. I been looking for resources. Like, where can I go? Do you take clients? Like, what, And I'm one person. There's only so hours in the day, and it bummed me out that I couldn't help every single person. And when I was looking for resources to refer people to, I was actually really shocked at how little there was for in terms of just support and programs that were out there. There wasn't anything I could find that really checked all the boxes. Nothing where I was like, yes, this practitioner is a trustworthy person. They're talking about all the things I want this person to benefit from. Like, I finally just got to this place. I was like, you know what? Maybe I should just make my own. And that's why I'm really excited to announce that my group coaching program, the Trauma Warriors Toolbox, is now open for enrollment. This is the course, honestly, I could have used this 20 years ago. Um, and it covers all the bases. It's not meant to be, I should say this first, it is not meant to be a replacement for talk therapy or other more traditional healing modalities, because those are still vitally important. And I am not a licensed mental health care provider. I'm a dietitian, health coach, and Pilates mat instructor. So that is what I bring to my work. So this course, we explore the roles of nutrition, movement, everyday stress management. So for those moments where um, feel triggered and need to come back down to, back down and get more grounded, or just if you find that you're more thrown off by everyday stressors and perhaps someone who doesn't have that trauma history, things to help you feel balanced. We talk also about mindfulness, meditation, journaling, and sleep hygiene. Is an entire module about sleep, because that one is so important too. So I would, I'm just so thrilled that this is something that I'm able to share with you guys. This is something I care so much about. I've wanted to create some kind of resource for trauma survivors for so many years, and I was just waiting for the right time, the right thing. And I'm so honored to be sharing this with you. If you're interested to learn more, easiest way to do that, you can go to my website, jessicacordingnutrition.com. You will find it on the homepage. You'll find it on the services page. And, if you're following me on social media, I'm most active on Instagram at Jess Cording. You can send me a DM there. I'm happy to share more info with you. But yes, the course officially kicks off January 23rd of 2024. So enrollment is now open. Doors close on the 19th of January. And I just wanted to share, I did want to make this course as accessible to as many people as possible in terms of financial cost, because I know that can be a factor, and trauma does not discriminate. People from all walks of life can experience trauma, and so to help with that, I am offering some full and partial scholarships, as well as some payment plan options. So please feel free to check that out. There's information about that on my website, and scholarship applications are due the 14th of January. So you want to get that in, please check that out, and feel free to get in touch with me with questions about that. But this is going to be a great group. I am to give you a little bit of info about what is in this course. It's an 8-week program, and I use a platform called Practice Better. So within that platform, you get access to some self-guided modules. So there's video, audio, there's meditations, there's worksheets, a workbook, there's handouts. And then we have a private group chat, and every week we have a private group call. So an opportunity for you to get individual support from me. And of course, secure messaging, so you can be in touch between sessions. It's meant to be a comprehensive resource. It's not just providing education, but also support from myself and from people who understand what you're going through. The trauma survivor experience can be so isolating. It's what's so fascinating to me is that it is so, I hate to say common, but so many people go through this stuff. And I'm not, there's so many kinds of trauma, big T trauma, little T trauma. And that, and it's not that any one is more or less valid than any other. And yet it can feel so isolating, it can be so hard to talk about. So I wanted to be able to offer some community aspect there. So if this sounds like something that you're interested in, I invite you to check it out. I will also link to all of this in the show notes, of course. But if you know of someone who might benefit from a resource like this, I would be so honored if you would pass it along to them so they can take a look and see if it's something that would be great for them. So as always, guys, I am so grateful to be here with you. Thank you for your time and your energy. And yeah, I hope you have a wonderful day. We'll talk soon.
Thank you for listening to Drama Free Healthy Living with Jess Cording. We'll see you next time.